While we wait for a vaccine to be developed for COVID-19, the state of New Jersey has announced plans on how to immunize people when it becomes available. Joining us now, Eagle News correspondent May Anne Manzano-Guerzon, who has details of this plan. Thanks for joining us this evening, May Anne.
Hi, Thomas, and thank you. State officials announced Monday during coronavirus briefing that New Jersey will aim to have 70% of its adult population vaccinated within 6 months once a COVID-19 vaccine is approved and available. Governor Murphy said the state submitted its vaccination plan to the Federal Centers for Disease Control on October 16 and emphasized that this is a work in progress and it could change. But he also stressed that New Jersey will be prepared once a vaccine is to be distributed. Take a look.
10 days ago, on October 16th, the Department of Health submitted to the CDC, that was a week ago Friday, the state's first draft COVID-19 state vaccination plan. However, this is not a plan that was thrown together quickly, as some vaccines have entered their final testing phase. Indeed, it is the product of months of collaboration among clearly the Department of Office of Emergency Management, other state agencies represented from state and local health departments, and certainly the Department of Health. We began our first discussion on how to ensure an equitable and workable vaccination plan, distribution, that includes distribution, allocation, vaccination, monitoring, at a time when the pandemic was ravaging our state. And one of our main focuses was to have the PPE stockpile and testing capacity we would need to fight this virus. In March of this year, Judy first convened the New Jersey Department of Health COVID-19 Professional Advisory Committee, which has been offering expert guidance on several crucial issues, such as allocation of scarce resources. And in April, the department began its planning for the distribution of potential vaccines that were in early phases of development. When those first thoughts about our vaccination plan were being formulated back in March, we knew that a COVID-19 vaccine was going to be an important preventative measure to help bring the pandemic under control. But with the knowledge the vaccines would not be available for some time, and the immediacy of the crisis in the state, developing a vaccination plan was lower on our priority list. We were just frankly trying to get through the day. But we knew that while we were tackling the pandemic in the short term, we had to look long term to create a stronger, fairer, and more resilient post-COVID New Jersey. This planning process kicked into higher gear in July as the vaccine task force, comprised of a panel of state experts, began its broader work alongside the state's coronavirus task force and other state vaccination experts, and with the CDC and the Federal Department of Health and Human Services. The goal was to focus on the hurdles and challenges that would await any viable vaccine: logistics and distribution, prioritization, vaccination, public outreach, and confidence building, among many other issues. Lessons learned from our childhood immunization programs, as well as the vaccine response to the 2009 H1N1 flu pandemic, were also brought to bear. Now, even though...
According to State Health Commissioner Judith Percy Kelly, to reach the goal of 70% population vaccinated in 6 months, about 81,000 residents of the Guardian State would have to be vaccinated a day for 5 days a week. By comparison, about 50% of New Jersey's population receives the flu vaccine, and a little over 70% of those are children, Percy Kelly said. A coronavirus vaccine is not expected to be mandatory, officials said, but Governor Phil Murphy stressed, quote, "We've got to make sure vaccine compliance is high." Governor Murphy also added that challenge will be to eliminate anti-vaccine noise, such as online rumors and social media-driven conspiracy theories, to convince people that the vaccine will be safe. The challenge, Governor Murphy said, will be to cut through anti-vaccine noise to to convince people that the vaccine will be safe to build statewide immunity against the virus. He also emphasized that New Jersey will not simply rush forward on a vaccine and will be instead be methodical and deliberate to make sure it's safe. According to a report of NJ.com, Dr. Anthony Fauci, the White House's top infectious disease expert, told BBC on Sunday that experts will know by early December whether a potential vaccine is safe and effective, but it likely won't be available in widespread fashion until next year. Health Commissioner Percy Kelly said that the federal government will likely make limited quantities of the vaccine available at first, and it's then up to the state to determine who gets it. Officials said one goal is making sure the vaccine is given out equitably, regardless of race or social status. Meanwhile, here is today's statistical report of New Jersey's COVID-19 cases. According to the Department of Health of New Jersey, we have 1,223 new positive cases, bringing a cumulative total to 229,684 New Jerseyans tested positive. Sadly, we have 7 new confirmed COVID-19 deaths, pushing the total to 14,503 lives lost. New Jersey remains on stage 2 of its road to recovery. And Thomas, for some weather update, it's currently 9:52 in the evening here in New Jersey, and it's currently cloudy. It is 59 degrees Fahrenheit or 15 degrees Celsius. The high today was forecast as 67 degrees Fahrenheit or 20 degrees Celsius. In Sicklerville, New Jersey, May Anne Manzano-Guerzon, Eagle News. We live in interesting times. Back to you, Thomas.
May Anne, a vaccine certainly can't come fast enough. Now, if and when New Jersey gets some in December, who will be on the priority list to receive it?
Good question, Thomas. Well, as mentioned in the report, it will be up to the state, and according to the New Jersey's plan, the first batches likely are reserved for healthcare workers who have potential exposure to the virus and those who are at higher risk. And this includes, Thomas, those who are 65 and older, those with pre-existing medical conditions, people who live in group settings such as prisons and psychiatric hospitals, and essential workers who can practice social distancing. Thomas?
Thank you, May Anne. And while we wait for that protection, stay safe and take care.
Thank you, Thomas. You too.